from People's Response Network. Dr. Ehrman was also a former Chicago Assistant Health Commissioner.
Well, okay. Um, my name's Lonette Sims. Thank you for having us here today. The People's Response Network is a grassroots organization with a mission to rebuild our public health infrastructure. Next slide, please. So last year, the city of Chicago launched the Cool Shot 2023 campaign. The Cool Shot 2023 campaign was an initiative due to the fact that the NOAA heat mapping project selected the city of Chicago as one of the 23 cities to participate in heat mapping. People's Response Network, we were one of the community-based organizations that worked with the city, the Chicago Department of Public Health in planning the Cool Shot 2023 campaign. On the day that we collected the temperature results is termed Activation Day. And on that day, we collected three different measurements in the morning, in the afternoon, and in the evening. And the afternoon had the most significant temperature gap compared to the morning and the afternoon. So there was a 22-degree Fahrenheit difference between the hottest areas and the coolest areas in the city of Chicago. And I also want to make note that the temperature, I also want to make note that the afternoon temperature data collection period was from 3 p.m. Central Standard Time to 4 p.m. Central Standard Time on July 28th of 2023, which was the third hottest day of that year. The hottest areas in the city of Chicago are African American and Latino areas on the southwest, west, and south sides of Chicago. Those communities were mostly impacted by redlining. So we see the legacy of redlining due to the fact that these community areas lack trees. These community areas have the highest amount of vacant lots, are closest to railroads, are closest to expressways, are closest to industry that generates excessive amount of heat, which leaves African American and Latino communities bearing the burden. Next slide, please. So in the 1995 heat wave, 739 people passed away in 4 days. And Black Chicagoans were twice as likely to die than white Chicagoans in 1995. And if you compare this map that lists all of the 77 community areas, and the community areas that are in Black had the most deaths. It's very similar to the Cool Shot 2023 results and also to the 1930s homeowners loan corporation maps, which started redlining. Next slide, please. So we suggest that the city of Chicago look towards Phoenix, Arizona in regards to heat lessons and what Phoenix, Arizona is doing to try to mitigate the heat crisis that they are experiencing. So in the first line, 645 heat-related deaths. That should actually say in Maricopa County. And there were 400 deaths in Phoenix, Arizona, and half of those deaths were of homeless people. Heat was the second biggest killer of homeless people in Phoenix, Arizona, and also unhoused people experienced third-degree burns from the asphalt being so hot during the excessive heat waves in Phoenix, Arizona. There's a good report called Streets of Fire that details the burns and also the number of people who had to go to intensive care due to the burns that they experienced. So, Phoenix, Arizona has implemented several policy recommendations to address the crisis. And one of those policy recommendations is called Cool Pavement Pilot Program. So this Cool Pavement Pilot Program, it sprays a water-based asphalt treatment on the streets. And that water-based asphalt treatment, it reflects the sun rays back into the atmosphere instead of absorbing it, which resulted in at least a 10.5 to 12 degree Fahrenheit lower average street surface temperature versus traditional asphalt. So People's Response Network, we recommend that the city of Chicago implements a cool pavement pilot program and prioritize the hottest community areas first. Thank you.
Oh, can you hear me now? Yeah, thank you. Good morning, everyone. Really want to thank the committee chair and in particular Alderman Vasquez for inviting us into this space. It's been a while since I've testified in City Council. I was the Assistant Health Commissioner appointed by Mayor Harold Washington for about 8 years. I think first and foremost, we want to honor the hundreds of people who have died in the last few days in one of the worst hurricanes ever recorded on Mother Earth, Hurricane Helene. There are hundreds of bodies that are still not accounted for. We expect the death toll to definitely go over 500. People who are unhoused during Hurricane Helene, just like in every climate disaster, are the ones by far at highest risk. The first slide comes from data from throughout the United States, including the state of California, Arizona, New York, et cetera. Even though in the state of California, for example, unhoused people only account for 0.1 to 0.2% of the population, 13% of all hospitalizations for heat are among unhoused people. Half the heat deaths in every state that has counted them is unhoused people. And I think you've heard great testimony before me about other disease problems with cold. It's true with floods, tornadoes, whatever. We had a situation 2 months ago that has never happened in the history of Chicago since white men took over the land from the Potawatomi in Miami and Ojibwe, and that is 27 F0 or F1 tornadoes touched down either inside the city limits or within 30 miles of downtown Chicago. The city, like every other city, is completely unprepared and unfunded, underfunded to deal with this situation. Next slide, please. One of the first things that this committee can do is to recommend by executive order that the mayor of the city of Chicago, Brandon Johnson, immediately change the policy at 10 South Kedzie today to back the way it was originally, which is that when people come in after 5 o'clock, they are not forced to go into a shelter. They can sit there. The second thing the mayor can do today is basically order OEMC, which is responsible for all these policies primarily, to stop kicking people out of any space that's a public space of the city of Chicago for falling asleep. Everybody here who's gone out in heat, gone out in cold, knows that it's a natural body reaction to fall asleep if you come into a heated or cooling space. When do humans get in trouble with heat or cold? We know the answer to this. And finally, the government of the United States, the federal government, and this government, starting with Alderperson Maria Haddon's 2022 cooling ordinance, are recognizing the reality. Once the heat index, which is the combination of temperature and heat, get to 80, all of us, even healthy people, start losing the ability to cool our bodies by sweat evaporating. Once the temperature gets to 50 or less at least, sometimes this can happen in the 60s, basically people get hypothermic. And a wind chill of 32 is when frostbite begins, not negative 15 degrees Fahrenheit or stuff you may have read in a newspaper. I'm 77 years old. We lived in about 8 different apartments until I was 14. And in 1986, with the support of Mayor Washington, we created the first heat ordinance in the city of Chicago, meaning that On the south side, in working class neighborhoods of color, in white neighborhoods, there was no heat at night during the winter unless the landlord lived in your building. That was the tradition that we changed in 1986. So the city can do this. We now have the support of the federal government. On July 2nd, President Biden announced that basically for the first time after trying to get this done for 20 years, the federal government under OSHA and the CDC have now proposed a heat rule for workers that starts at a heat index of 80. This is incredibly significant. The details are here in terms of what has to happen, but it's quite specific about cooling, about providing water, education, et cetera. Next, we have the 2023 proposed Chicago Heat Illness Outdoor Workers Protection that was sponsored originally by Alderperson Haddon and my actual Alderman, Mike Rodriguez. This is another significant step forward that, again, starts actions beginning at 75 to 80 degrees outdoor temperatures. The 2022 cooling ordinance we already talked about, and we want to thank Alderperson Haddon for basically listening to ourselves and a lot of other people and changing the actual trigger point from 90 to 80 heat index. Very, very important. Next slide is that in the last week, it was announced by the city of Chicago that police are going to be taken off of mental health emergency response programs. Exactly the same thing has to happen now with emergency response to weather. What's happened since we decimated the Chicago Department of Public Health and Department of what we used to call Human Services, together which have lost 3,000 workers in the last 30 years. We used to have 2,000 workers in the Department of Health. Now we have about 700. Dr. Ige, thankfully, is increasing that slightly. What has to happen is police have to be replaced by workers from the city of Chicago who are community health workers, who are outreach workers from the Department of whatever it's called now, Family and Human Services. We don't want police knocking on people's doors. We don't want them showing up with the gun in their holster for somebody who's got a weather-related emergency. Next are the actions the city has taken in the past and can take in the future. In 2006, there was a major blackout on the south side that affected over 100,000 people. And the city responded by sending out dozens of CTA air-conditioned buses that people could just get on. That has to start happening now with the temperature, heat index, cold temperature figures that we gave. That has to happen this fall, this winter. It's a no questions asked policy. You don't ask people when they get on the bus, or you want to sign up for a shelter. That's not the reality of unhoused people. If they want to sign up for the shelter, they should be given that choice, but they just get on the bus. They get a blanket, they get something to eat, they get some warm stuff or cool stuff depending on the situation. The other things it has to do that other speakers have mentioned is that we have to open up cooling centers, and probably the most relatively friendly place are the 81 libraries to be 24/7 cooling warming centers. We now up to, I think, about a dozen libraries, maybe a little less, that now have social workers hired by the city. This has to be expanded, but the libraries are probably the most logical place that people could walk to and get to if they can't and they don't want to get on a bus. We need to have people go out before this happens from the city of Chicago and from the nonprofit partners that are sitting here and testifying to do simple things for people to prepare for extreme weather, to encampments or whatever. There are $2 NASA blankets that can keep people safe to a certain point from freezing to death. And there's lots of other things like this that could be done by the city. The city recently began to give out backpacks through the Department of Health. We gave out 1,000 backpacks this summer for emergency response. I think that's a great start, but we need a lot more, and those should go first and foremost to unhoused people. Geographic priorities. Everybody here knows where the encampments are. So that's where you go first, and then you go to the neighborhoods that have the least amount of air conditioning. We know that from the U.S. Census data. The long census actually asked that question. And we all know now that even though people may have more air conditioners than they did in '95, far more people are not flipping the switch to turn them on because the electricity rate has tripled in terms of the cost. And we have to enforce the new state law that came online this year that there can be no utility shutoffs during periods of extreme heat and cold. A lot of actual alder people didn't know about this law until we brought it to their attention. It was passed last year in the state legislature. It's got to be implemented and enforced. Lastly, we want to talk about the problem with statistics that you're hearing today and in the past. The only statistic that really matters in terms of, in addition to what we've heard today, is the statistic that Dr. Steve Whitman, the chief epidemiologist of the city, almost got fired for by Mayor Richard M. Daley. And that is 739 people died in 4 days. You cannot do this by death certificates. Physicians are not going to put on the death certificate 99% of the time that this person died of heat or cold or a tornado of flooding. What they're going to put, and the same thing has happened under COVID, what they're going to put is this person had diabetes, this person had heart failure, that person had hypertension. So going by death certificates is a little bit helpful, but you have to calculate excess deaths. It's real simple. You go back about 10 or 15 years, like Dr. Whitman showed in the movie Cooked, which if you haven't seen, it's super important to watch. We're happy to show it here. And you calculate how many people died today on October 1st compared to the last 15 years. You adjust it for population, although the population of the city hasn't changed much, and it gives you excess deaths. That's it. So we're calling on funding for CDPH to be able to do this in real time with excess hospital visits, excess hospitalization, excess deaths. Lastly, and I'll finish here, where's the money going to come from? We all know where the money should come from. You got to pass and re-implement the head tax. That's at least $100 million bucks. You got to pass the financial transaction tax. That's several $billion. And you got to move police department positions for first responders into the Health and Human Services Department. Thank you very much.
Thank you, Dr. Ehrman, and thank you, Lonette Sims. Next is Isabella Mancini, who is going to talk about Harold Washington Library serving as a 24/7 warming center last winter.
Hello. Oh, good. It's going to be hard to follow you, Dr. Ehrman. I am Isabella Mancini. I use she, her pronouns. I am currently a program director at Healthcare Alternative Systems. I'm a licensed clinical social worker,